bend their legs, and then the other towel. If you see it's a summer day like today, that should be enough really. The idea of the cover is keep modesty and keep warm. It's all right to leave it if it's too hot. There is no modesty issue. So just for the preparation today for the final assessment, why don't we leave the other towel? Because I showed you before how to do it, yeah? So let's leave the second towel. And now let's work on the lower part of the body, okay? But here it comes. When you work on the lower part of the body, take your shoulders out, please. Okay, cool. And tuck this towel underneath. Yeah, good. When you work on the lower part of the body, you can do it this way, but very quickly you see that the towel needs to be extra covered here. Yeah? So you do need two towels. Lift in between your legs, thank you. And then go out. Good. So, when you do that, so you have the second towel coming around and wrap around so it's all nicely covered, yeah? And you can do the lower back with nice technique. You can come from here. I like also to come from this position, and you can use the base of your wrist, yeah? Now, there is so many things that you need to be considered. You need to be considered the contact. Yeah? If I would see that the client, eyes open, and I'm kind of really hot and sweating, I'm not going to do it. Because you need to really consider the situation here. If I see that she's kind of relaxed, eye closed, that's fine. If not, I will have to find alternative to my position. Yeah? Keep working. What was it about the area that you can't feel? It was Linda, isn't it?
Yeah.
You've said that some client never feel it. Right. So let's say it happens here in this position. And there are two ways you can go about. You can say, okay, I'm going to just show it that they're going to feel it. Now, I'm going to go really strong or do it. Or you can work in kind of a maybe more movement-oriented ripple, quite deep, but not 100%. Because if you don't have sensation, you don't know what's going to happen, so it's unexpected. So work with a bit more, bringing air, lift your head, thank you. Bring air into that area, mobilize it, awake it. Yeah, into here. Yeah. So a lot of, even myself, when I started massage, it was all about pushing into the table, massaging. Everything was kind of this way. The more I practice, I realize it needs a lot more movement. Movement is really important for the well-being. Yeah? It goes to the brain. It improves the circulation. It nutrients. It stretches the muscles. It relaxes the muscles. It does really amazing things. Yeah. So don't only press on it, but mobilize it, move it. Yeah. Yeah. So is that okay? Yeah. Now let's move on to the lower body. Right. So when it comes to you can see more. When it comes to lower body, what you do is kind of creating a sling with the upper towel. lift your leg, thank you, and then drop it. Yeah, good. So what you do is creating a sling with the two legs. Good, thank you. And then put the two sides of the sling underneath, in between the legs, so it's secure. Okay? So here you are free now to work on the lower limb in this position. However, just be sure that the leg needs to be quite bendy. Fantastic for, who did we talk about, the iliotibial band? Rob, it was your client, isn't it? Yeah. So coming with some stiffness in the way they walk even, you know, working on this area, nice elbow, but be careful, it's one of these wasabi muscle. You know what is wasabi muscle?
No.
No? Have you ate wasabi lately? That is burning?
Oh, yeah.
So it could be like the same sensation of burning pain, quite intense. Who've had this kind of experience on the iliotibial band?
I had one on the...
A lot. A lot. When it's like, wow, are you sure? You don't feel anything there, but it's very, very tight, okay? So a lot of stimulating of circulation, working there, and then after that, deeper work. Don't start right away deeper work, yeah? Hamstring, fantastic. You stabilize it in here, and then massaging around the hamstring, around the knee, yeah? Really nice to feel the tendons there. Gastroc, soleus, yeah? Glute. When it comes to glute, another few really interesting trigger point. Gluteus, the gluteus has the greater trochanter, yeah? Claire, or can you show the group where is the greater trochanter? Do you know where? Yes, good guess, wonderful, good, good. So well done. So this is the greater trochanter. It's in here. So it works like that. From here, there is in front of it a little bit. If you want to come closer and see, there is the gluteus minimus. Yeah? Gluteus minimus in here. Gluteus medius is right in the center, and the rest is gluteus maximus. So I will suggest you try to see along the line of gluteus medius and feel it. Yeah, it's quite tender, and it's well linked to hip pain, to lower back pain, to tension from sitting. Just tension from sitting, from not moving enough. Yeah. So that would be really good. And you can work, a nice way to think of it is think about the center of the clock is the greater trochanter, it's the bone. And then around there, the kind of other muscles, yeah? If you go to 6 o'clock, is the iliotibial band. If you go to, 9 o'clock, and this area is gluteus maximus. If you go to 12 o'clock, is gluteus medius. And gluteus minimus and the tensor fascia lata is a little bit, it's a tickle, and it's more in front. So if it tickles, what should I do? Go slower and deeper, yeah? Okay. So I was just doing too much, so, okay. Is that okay? Yeah? Maybe one more thing that would be quite useful for you is working on the Quadratus Lumborum in this area. And Quadratus Lumborum, you can do it really nice by just putting the towel this way, and you can come and work. So you're putting your hands here, and you palpating it on the side. Yeah, a nice move with on the hip. You want to come and see that. So again, your hands are a little bit in front. Now, some people may not feel comfortable putting your hands on the ribs. I think it's all right. If you feel that the person is not agree with that, then you can come from here and then come from that position. Because sometimes you may feel for them is it's too personal. Yeah, too personal. I haven't found out, but potentially it could be. So how do you palpate in here? The most superficial muscle is what? Erectus spinae. So you can't come to the Quadratus Lumborum from here. You need to come from the side. So the way you're palpating, you're going there, okay. I feel still a muscle here. And then lift it a little bit, move it a little bit. Okay, still muscle. Lift it a little bit, move it a little bit. Right, here I fall into an emptiness because I'm onto the abdomen already. So I go a little bit backward and the muscle is there. Okay, so when you're palpating, I want you to do the same softness. If you start doing that, why, where, what? Come on, tell me. Okay, so it will have to take you at the beginning 3 times the amount of time it took me. Because you really need to sink, ease. Okay, I feel the muscle. Lift. Look at what I'm doing. Move a little bit. Sink again. Because I cannot stretch the skin too much. Basically, I want to palpate. Is it here, here? So I need to really take it into turns. You're still treating, but you're also observing and looking. Okay? Should we, do you want to try that, or it's enough by video, or?
Shall we try?
Do you want to give it a go? Good. If you give it a go, please kind of take your trousers as well, because I want it to be